Hey everyone, this is my friend the Buddha. The Buddha, as you'll notice, has a little bit of a tummy. He's also smiling, so maybe the happiness is bringing him obesity. But you'll also notice he's balding. That could be a testosterone deficiency. Could be that his adrenals are shut down. Could be that he has prediabetes, diabetes, high cholesterol. That doesn't matter. So the tutorial for today is on bloating. Bloating, which is also belly increased girth, is different than obesity. Obesity, you can be walking around happy, no problems, no pain. Bloating is different. And that's what I'm going to explain. This schematic shows the digestive tract. It starts actually up here with the stomach, the mouth, goes into the stomach, ends up in the small intestine, the colon, and then this is out the anus. And it's about 27 feet long. I've talked about it before. The problem I can explain this way is when we have anybody that has to undergo abdominal surgery, the old-fashioned way, when you had to cut through the front of the belly and then kind of push things aside to get to an ovary, to get to the pancreas, or to get somewhere, you have to push aside omentum, which is the fat apron, and small intestine, usually, because the small intestine is really curled up in there. And we found that when you have to mess around with the whole small intestine, even if you just have to move it one time only and hold it off to the side, it usually will become paralyzed. The whole digestive tract, like I said, is about 27 feet in length, is pure muscle. It's like a snake. So it's supposed to take a food bolus from the mouth, take it through the stomach, squeeze, 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 until it gets all the way through. So that muscle has to be very strong. That's why 30% of your calories per day, approximately 30%, are used up just for the act of digestion. Now, the act of digestion releases more calories, so the investment of 30% of your daily basal metabolic rate is worth it because you can make a lot more out of the food you eat. This is the phenomenon of when you go on a fasting diet or an elimination diet or a detox. Usually the first 2 or 3 days where you don't have any food, the stomach and the small intestine and the large intestine don't have to do anything, so suddenly you free up 30% of this energy, and some people will feel really invigorated because you free up. But after a while, you're going to run out of fuel source, then you'll kind of crash. So the digestive tract is very scientific. It's very complicated. And what sometimes happens is when that belly or the small intestine and large intestine get moved, you can have it paralyzed. When it paralyzes, the muscle goes from, say, garden hose size to fire engine hose size. It'll go back down in time, but it takes a little bit of time. It takes a little bit of bowel rest. It takes a little bit of walking around. It takes a little bit of turning on of the stomach to, sometimes if you stimulate the stomach with a little bit of food, not solid too much, but after surgery, stimulate this, it'll start to send the messages down the rest of the vagus nerve or the enteric plexus and stimulate everything to move again. So that's after surgery. As far as folks getting it, what can happen is the small intestine can go through a couple of different irritating scenarios. I'm going to just start by going through what the stomach, from stomach to the large intestine, and go through what usually causes this enlargement. It can happen in the large intestine too, and it can happen in the stomach too. So as far as bloating, if I have, again, 27 feet of garden hose and suddenly different portions of that garden hose become enlarged, I'm going to have my abdominal cavity filled up with, well, needing more space because you suddenly have to fit in 27 feet of fire engine hose. And if you've ever seen a fire engine hose after a house fire on the street in the movies or in pictures, it takes these guys a long time to put the hose back in after it's empty. So that's a lot of space that is needed, and usually what happens is the tummy stretches out to accommodate. And that's where you get the time when you have to unnotch the belt or a couple notches. So what can happen? The first thing that can happen is in the stomach. We'll start with that. If the stomach has, say, too much acid in it, too much acid, not enough mucus that's being produced, or not enough lower esophageal sphincter tone, you'll have irritation because the acid and the mucus and the food that's turned into vomit, it'll kick back up as this stomach churns. Stomach has to churn. It has to turn solid food into liquid. And the only way to do that is to mix that solid food you just ate in with acid, and it churns it, it melts the food, and eventually it goes on down to the small intestine. But in some cases, when you don't have any good lower esophageal sphincter tone, you have this acid kick back up and it causes an irritation. The irritation causes the stomach to kind of flare open or get enlarged. That's bloating. That's when you have to keep on belching gas. So that's one form of bloat. Usually you can disperse the bloat by burping up all the time. It also feels good because you stretch the stomach and then you decrease the distension. So the other thing that also happens is that when the stomach gets irritated, it sends a reflex all the way down to the colon. It's called the gastrocolic reflex. And when the stomach gets irritated and it dumps food because it didn't like that hot potato, it gets rid of it and dumps it to the small intestine, or it makes you throw it up. If you don't throw up, it dumps it to the small intestine. Suddenly the small intestine has a hot potato. Stomach says, oh, thank God. But when it dumps it fast, it turns on the colon, gastrocolic reflex, to dump. Because if you're moving fast, colon's got to get rid of its contents, so it's a normal reaction. Babies have it all the time when they suckle on a bottle or a breast. Usually within, half an hour, they have to poop. And that basic reflex is a basic reflex. Clears out any contents from down here to get ready for the new contents coming down. It's also a toxin reaction, because if the stomach got a toxin and you can't throw it up, it pushes the toxin all the way down. Everything comes out liquid. Because here you're supposed to have formed stool, that gets moved. Here you're supposed to have liquid, that just came out from the stomach, so it's easy to digest in the small intestine. All the digestion occurs in the small intestine. Small intestine, I don't have it illustrated here, but the inner lining of the small intestine is with tiny finger-like projections called villi. And they're full of blood vessels, and when the liquid food passes by the villi, if these are the villi, it's almost like raking the food. You take the food, you pick up the particles, it goes through the villi, and you absorb anything that's a macronutrient, a micronutrient, a vitamin or a mineral, and you put it into the bloodstream and it gets to the liver. So that's the way the microvilli is supposed to work. And you can't have that if that's a solid piece of material. So if food is undigested because you didn't chew properly, check out my video on DrRic tutorial slowing down and you'll see what I'm talking about. Then it gets presented as solid food. Solid food causes this tiny little garden hose to become a fire engine size because it didn't like what you gave to it. So it says, I don't want that either. And it passes it fast through all the loops of the small intestine into the colon. So that's called ileus. I mentioned that already. That's what happens after surgeons muck around with the small intestine and large intestine. It can also happen from the inside out. If the small intestine is being presented with irritating food, that's usually foods that cause allergy or allergy-like reactions, toxins, something that's an irritant. Irritants can be in the form of metals, it can be in the form of plastics, it can be in the form of parasites. But parasites will form more into the infectious possibilities of irritants to the small intestine. And then there's also genes. If you happen to have the gene that gives you Crohn's disease or celiac disease, then you're going to have some problems in the small intestine. Either way, with all those reasons, you get garden hose to fire hose. And if fire hose occurs, again, and this is the majority of the length of the 27 feet. Say 20 feet is all small intestine. That means you go from 20 feet of garden hose, which can be spooled up into a tight package, to 20 feet of fire engine hose, which can't be spooled up into a tight package, and it needs room. This will need room to grow. And again, that's either ileus from messing around, and hopefully you don't have to have surgery, or ileus from the inside because of bad food, or poor digestion. The other thing that can also cause it is when you have this thing called the pancreas, and food is normal with its transit time, the pancreas is supposed to meet this liquidized nutrient, and here it secretes enzymes to start the digestive process so that all the nutrient is ready to be absorbed. When the pancreas doesn't secrete enzymes, no enzymes, or it's failing as an endocrine organ, you'll not be able to break down food further. There are tests you can do for that, amylase, lipase. Sometimes the lactase in the stool can be checked. You can actually do a cheap test if you don't have good insurance. You can't get those fancy stool and blood tests. You just take a digestive enzyme. So if with every meal you take a digestive enzyme, that's the enzymes that are supposed to be in here, you've got the enzyme and the food together, it'll break itself down so that the small intestine doesn't have to work. Sometimes that's necessary if we have a pancreas that just doesn't work right. Or if we've had somebody that had part of their pancreas taken out, it's worth it to have digestive enzymes. Sometimes patients that go through Roux-en-Y or gastric bypass also need digestive enzymes, so that will help in the process to keep the small intestine on the small side. I also mentioned here emotion. Emotion can irritate this whole sequence of going from stomach to pancreas to small intestine. So if you're totally stressed out, if you're about to present a tutorial, if you are being bullied, if you're about to lose your house or go into foreclosure, this system is not going to want to have to digest too much. It's going to be irritated. And it's going to say, I'm not dealing with this now. That's usually what happens with this. The lower esophageal sphincter loosens up. You have reflux. Not enough mucus gets produced by the lining. So the little bit of acid, or the acid that you produce more of, really burns a hole into the usually protected lining of the stomach. And then it passes all that crap on down to here and just irritates everything. That's the beginnings of IBS. And you'll know that if you have a history of IBS, emotion will always trigger it as well. So the other thing that sometimes if we're just going to stick with the small intestine as being the reason for the bloat, it can be something called increased intestinal permeability. In layman's terms, so it's called leaky gut, but we can't use that in medical terms. There's actually a definition for increased intestinal permeability. And if that happens, that means those little junctions that's supposed to... There's the lining of the small intestine, as I mentioned, is full of villi. And the villi is supposed to have tight junctions. If you take it down to a electron microscope level, if you look at one of the villi have a wall, and the wall will let some macronutrients through to get into the bloodstream and keep other things out, like bad bacteria, parasites, toxins, and all that stuff. Well, if the lining of the villi suddenly is wide open, it'll let anything through. That's when you let big proteins through. That's when you let mercury through. That's when you let other animal products through. And then the white blood cells on the other side in the bloodstream start to taste this stuff, and they say, this is a foreign body. We're going to cause an allergic reaction. And it sends then the white blood cells on the other side of the villi in the bloodstream start to send out antibodies to attack the big proteins that shouldn't be there. And you wind up with this food type allergy, and not a good setup, but that's usually a leaky gut issue. And it leads to brain fog, loss of hair, adrenals get turned on, autonomic system gets screwed up, and then there is usually a rheumatologic disorder that follows that. Skin issues, joint issues, collagen vascular disease. It's not a great picture. So it all starts with having good gut health. There's also something called small intestinal bacterial overgrowth, SIBO. That's a new diagnosis now. It's when the bacteria that are normally supposed to be in the colon start to inhabit the small intestine. You're not supposed to have that many bacteria in the small intestine, and when these bacteria go this way, because either there's not enough acid in the stomach to break down the bacteria that are coming through, and guess what causes acid to be halted? Proton pump inhibitors and H2 blockers. And what do we take most of? We're not supposed to take? Well, Protonix, Prilosec, Nexium, Prevacid, Omeprazole. All these things will decrease acid, but you need acid to digest protein. You need acid to make B12 cleaved up. You also need acid to help the digestive process so that these guys work down here. And when you don't have any acid, because of symptoms, whatever the reason, then you'll have the beginnings of problems down here, and the bacteria can you can have an overgrowth of bacteria. You can also have, with constant antibiotic showering of the belly, the body, the blood, you'll have some bacteria die, you'll have a lot of nasty bacteria live, and sometimes you'll be infested with bad bacteria into the small intestine. That's not good either. So for a diagnosis of SIBO, you have to do a hydrogen test. It's a breath test that sometimes insurance companies cover. And then a stool test would be important, parasite test would be important. And there is a pretty decent protocol. You take one big antibiotic, it wipes everything out, and then you re-inhabit the colon with good bacteria, probiotic, sometimes even a fecal transplant. And then it starts the whole process, hopefully over again in a nice manner where you don't have bacteria in the small intestine anymore. So anyway, when you have bacteria here, it causes irritation, it causes a reaction, and then you have the bloating as well. And then I finally put down here that you can have excessive amounts of methane collect in the large intestine when food is not digested properly, or when you have crappy food, or when you have no acid to break down food, and it's essentially passed as a hot potato into the large intestine. Large intestine has a ton of bacteria. That's where your probiotics are, if you have good probiotic. If you're full of bad bacteria, yeast, parasites, they're going to hang out in this large intestine. And when food gets put down fast, or you don't chew properly, you don't digest, you feed these little guys here, and they just love fat and food and undigested fiber. And if it's the wrong combination of bacteria in your large intestine, you're going to have methane excessively produced, gassiness, bloating, distension, farting, diarrhea. Not fun. And again, for that, it's sometimes you got to check a stool test to see what kind of bacteria you have growed out. You have to check for infection, parasites, C. diff, other bacteria that you shouldn't have. That's why it's really important to keep a really good ecosystem in this bowel, because when you get hit by chronic antibiotics, you'll kill all the bad stuff, say in your sinuses, in your chest, in your urine, but then you'll also kill all the good bacteria in this large intestine, and you will re-inhabit again. But whether you re-inhabit with good guys, lactobacillus, bifidobacter, streptomyces, it's going to be determined on your digestion, you're taking your probiotics. So see my tutorial on DrRic tutorial probiotic 1 and 2, and I'll give you some ideas about what to look for. Also, DrRic tutorial IBS 2, as far as the idea of all this thing. There's a biome that has to be balanced, and sometimes starts with just good digestive health and food. So then again, there's also genes that sometimes get you predisposed to ulcers, Salazar Ellison syndrome, or what I talked about as far as Crohn's disease or celiac disease. Or sometimes you'll have problems with the large intestine that are inherited down from others in your family. So that is usually what happens with bloating. If you fast, as I mentioned before, you might be able to stop all that bloating, but you'll also free up that 30% of your energy that usually gets used up to digest this and work this factory, which will give you a little bit of energy at first. But then if you stay on a too restrictive of a diet, it'll still keep this work to a minimum, so you won't use up so much energy for the digestive system, but then you're going to run out of fuel. So if you're continuing to exercise, if you're going through problem solving, if you're running a company, if you're taking care of a family, you're going to hit the wall. So there's a fine balance. That's why it's so important, whether you're in a competition, whether you're fighting a disease process like cancer or high blood pressure or cholesterol, or whether you're just trying to get through a stressor of life, the decade of stress. Everybody has a different decade. You need fuel, and if the fuel is killing you, you don't want to be doing that. If the engine that takes care of digesting the fuel is also not working properly, you don't want to do that. So bloating is usually a sign that there's something off. If you don't listen to it, it can become worse. If you do listen to it, come in and see one of us. We might be able to help. You can actually, if you have a PPO, you can go straight to a GI specialist, maybe get a colonoscopy, an EGD, an upper GI, a CT scan belly, just blood tests or stool tests, as I talked about. But all these all depend. You can't do $1 million workup, especially with insurance nowadays. So as far as picking and choosing, we have to hear the symptoms. We have to go through the history. We have to go through your family history. It's important to get to a doctor that does integrative medicine or practices as a gastroenterologist. So hopefully this helps with figuring out how to deal with the symptoms. I think that if you know the pathology and how it starts, you can kind of reverse engineer your problem to see where in the timeline your issues are: stomach, small intestine, pancreas, large intestine, and then hopefully get to reverse the cause and not just take care of the effect with prescription medicines. So even if you are doing well with Lialda or an H2 blocker or a PPI or a Crohn's disease, rheumatologic medicine, I still say it's important for you to progress on and know your disease cause.